he says, well, funny thing, I've just spoken to Cameron McIntosh. And I said, but I don't know who's Cameron McIntosh. And he said, no, he's an ENT in PE. And he said the same thing to me. He said, we've got to get a Rhinoplasty Society together.
Ladies and gentlemen, welcome to another episode of the Rhinoplasty podcast with me, Dr. Cameron McIntosh. We are in the month of August, and the theme for this month is International Experts, and it's brought to us by Pentax Loupes. Guys, you know Pentax Loupes are absolutely brilliant. I use them. I love them. There are a lot of loupes out there, but shout out to them for bringing this educational podcast to people from listening all around the world. And today, it's a man I've been wanting to interview for more than a year, but he is so elusive. The president of SORSSA, Stuart Geldenhuys. Stuart, welcome to today's episode of the podcast.
Hi, Cam. It's great to be here, and it's looking forward to having a chat with you to talk about all things rhinoplasty, I guess.
Yeah, we won't just talk rhinoplasty. There's so much to chat about apart from that. But Stewie, it's so nice to be able to chat to you. And I thought for the listeners, just to explain to them how you and I we've met for the first time in 2016 in Versailles, if I'm not misunderstanding, eh? Tell us a little bit about what your impression was of this Cameron McIntosh guy when you first met him.
Oh, that's a funny story. So, well, I'll take a little time. It was actually September. It was the IMRHIS, so it was the International Meeting of Rhinoplasty Societies, and it was in Versailles in September. It was, I think, the 6th to the 8th of September, and I was well on my way to becoming a rhinoplasty geek at that point. And I remember going there with Peter Scott. And he was the only other guy that I knew was there from South Africa. And I recall having met him and said to him, Peter, listen, we really need to uplift rhinoplasty back home. And he says, well, funny thing, I've just spoken to Cameron McIntosh. And I said, but I don't know who's Cameron McIntosh. And he said, no, he's an ENT in PE. And he said the same thing to me. He said, we've got to get a Rhinoplasty Society together. And I guess so from an independent perspective, we both had the same idea at the same time. And I guess that was the start of our kind of collaboration. I think it was a year later that we actually kind of got things going.
Yeah, I tell you, Stu, it's been great. I mean, the chemistry is wonderful with how we've got on. Tell the listeners, so where did this whole rhinoplasty journey start for you? I mean, you grew up in South Africa and then you went to medical school and you became a plastic surgeon. But talk us through what brought you along this route.
Sure, Cam. I think, it's a difficult thing to put into any single. Was it a single moment? I don't think so. I think it's a kind of a progression. From the beginning, I always knew I wanted to be a surgeon. I was definitely more surgical than physician in my makeup, and so it was a progression from general surgery, then through to plastic surgery, and I guess it was interesting. Is I recall doing studying for my final exams, and I spent an awful lot of time in the rhinoplasty section, really looking at the detail. I recall speaking to one of our colleagues, and he looked at me, and he had qualified already, and he was giving me a few words of advice and doing a bit of tutorship. And he said to me, you don't need to know that kind of information. And but I just recall becoming completely immersed in studying rhinoplasty at the time. And I guess, so it's in small little steps, the first part of your plastic surgery career is generally reconstructive based, and it's, and probably a lot of breast surgery with very little facial work. And it was after I spent 3 years as a consultant in the Department of Plastic Surgery at the University of Cape Town, and progressively went into private practice. And I guess it was in the subsequent years that I really started kind of exploring rhinoplasty and doing rhinoplasty quite poorly, as I recall. But it was a progressive journey, and I would say probably for the last 6-7 years, it's really become my passion.
So, are you currently in full-time private practice?
So currently, I'm actually a part-time consultant at the University of Cape Town. With COVID for the last few years, obviously, my services and the services of the hospital really have been curtailed. So the involvement in the last few years has been very limited. But I'm still part-time consultant, sessional specialist, but the rest of my practice is private.
Oh, that's awesome, mate. And Stewie, just slightly digressing off the rhinoplasty side, I mean, you also married to a doctor, if I recall.
recently, but not recently married. So so I can say very proudly that my wife got a doctorship about 3 months ago in forensic law. So, and I must say, when you see the amount of work that goes into that, it's quite a special achievement, I must say. They don't hand those out. They don't hand those out very easily, I must say.
We're very proud of what she's done. So, Stewie, we're so lucky to operate together at times, and I'm right-handed and you left-handed, so we can actually do like a rhinoplasty in half the time. One of the more amusing things I find is working with you is that you are so dedicated to perfection. And I'm like, Stu, we've been at this now for like 4 hours. Can we now have a break? And I find that so inspiring. It's amazing. Where does this come from, this thing of wanting to be perfect in what you're doing in rhinoplasty?
Oh, Cameron, it's so funny that you say that. You know, I think intrinsically it's just kind of built into you. For one, you're right. I mean, I certainly know that I have an eye for detail, so I can't let things go. If I see the slightest thing that isn't correct, I will chase those down. So I guess it comes from seeing, first of all, and I think, I mean, I recall many times operating with you, and I recall those moments where I could see you were like, Stu, listen, it's time. We can stop this operation now. But I what's interesting, Cam, is that I've spent some time with some of our colleagues from around the world, some of the exceptional surgeons around the world. And what's really interesting to me is that many of them operate in a very similar fashion. And I'm talking about really some of our really most exceptional surgeons that we learn from constantly. And for me, that's really vindication that that time spent on the detail is really worthwhile. Certainly, in more experienced hands, it's performed in a way, kind of in a more what's the word I'm looking for? In a more efficient manner, certainly, and I think that's about experience. But that detail, that the surgeons are fixated on that detail as well, I think does give me hope that I'm on the right path.
Yeah. So, Stewie, I want to ask a slightly different question now, because this is more for possible like patients who are listening. You don't just do rhinoplasty, though. What are your other main interests that within plastic surgery that you do?
Cam, again, this is I think the one thing that I always think about is what do you want to be doing? I consider, what do I want to be doing most of the time? And I think, in your practice, when you start out, you take whatever you get, for better, for worse. And I think as we go on, we have the privilege now of selecting those things that we really are passionate about. When it comes to, and I'll get back to your question, but when it comes to rhinoplasty, we recognize that this is an exceptionally difficult surgery, and it requires absolute dedication. So, I don't foresee myself, I'll get back to the original question, I don't foresee myself doing much more than rhinoplasty over the course of the next 5-10 years. But at the moment, because of where I've come from, I'm still involved in breast surgery, and in many respects, that was that's what my practice was built on initially. And I also really love facial aesthetics, and I do quite a lot of non-surgical facial aesthetics. And I think the advantage of that for me is that, particularly with filler treatments, not so much Botox, but constantly you're assessing facial harmony, balance, proportion. And I think it helps to train your eye in facial aesthetics and facial balance. So for me, I think that the combination of doing nasal surgery and facial aesthetics really helps in terms of balancing, because I think nasofacial proportion is something I often see, even if it's a nice nose, where there is some disproportion, and there may be reasons for it, but it does maybe detract from a perfect result. So I'm quite sure I'll continue to do non-surgical aesthetics, and as I said, I think my passion's taken me further and further down the line, probably to an almost exclusive rhinoplasty surgery practice.
Yeah, it's awesome, Stu. I've learned so much from you in many ways. And one of those things is not just to focus on the nose, but to look at the whole face. Okay, so let's chat a little bit about something quite different. You have got these really cool scrubs on, the World Rhinoplasty. Now, this was something
the only thing I just want to say, Cam and I had we hooked in earlier, and Cam just said how disappointed he was that he hadn't worn his World Rhinoplasty Day scrub. So, Cam, it's okay. But just for anybody, this is the SORSSA logo, and this is the World Rhinoplasty Day logo. And Cam, maybe I can put it to you that maybe you can, because that originally was your baby in terms of sort of the sort of concept, and maybe you get to explain how you see World Rhinoplasty Day going forward, because we haven't forgotten about it yet.
No, not at all. I mean, we've decided that we will have the World Rhinoplasty Day as the equivalent of the Olympics of rhinoplasty. So every 4 years, we're going to be doing it. We had our first one in 2020, and we'll have our second one in 2024. And kind of what had come out of it. So I think kind of maybe dialing back a bit, SORSSA and how it started, is it's amazing to me how our passion for rhinoplasty brought in many ways the plastic surgeons, the ENTs together to do a society that I think has changed a lot in how rhinoplasty is educated and seen in the world today. So SORSSA has been going now for 6 years, and during the lockdown, I noticed that there were so many people that almost like self-promoting. And I thought to myself, no, man, this isn't the way it should be. Let's get the boys to fight it out. So I approached some of the really big hitters, and I put this idea to them. I said, guys, why don't we have like a preach-off? So we would then, and it morphed, and it was just so nice to have people like Faisal and Wolfgang and Enrico who then put their hands up and said, yes, let's do it. And having the SORSSA team come together, we did this 24-hour webinar where every region around the world, starting in Japan, working its way all around to the west coast of the States, a society or a region got to present in this webinar. And I don't think any of us really thought it would happen, but I decided to myself, I thought, let's do this like the Olympics. Let's get the guys, number one, to put their best foot forward, not limit them to how they should. But secondly, the thing that was to me probably the most important was that we got the editors of the 3 biggest journals within the world of rhinoplasty to be our judges. And Jeff Marcus sorted everybody out and won the gold medal. Yeah. Okay, Stu, tell me a bit about SORSSA. I mean, you took over the presidency at the World Rhinoplasty Day 2 years ago. You've had a tough 2 years to try and do stuff, eh?
Yeah, look, I mean, I think the world's been a tough place for the last 2 years, but I think, the SORSSA Exco really is a group of like-minded people. We work together. I think president, not president, they're not really, for us, as you're aware, those titles are not really relevant. I think, we have an objective, and that's something that we set out to achieve a long time ago. And obviously, the main objectives were promotion of higher standards, professional skill, and competency amongst rhinoplasty surgeons in South Africa, and obviously the collaborative nature between different societies and different specialties, plastic surgery, ENT, and then the other thing that was really important that we also wanted to do was also the international cooperation with societies around the world, and obviously that's for the advancement of the knowledge of rhinoplasty. So, I think this is for us at SORSSA, this is an ongoing process. And I think the momentum that's been generated, I think SORSSA has had a reasonably key role in that, is to be part of a movement where there has been a lot of collaboration. And I must say, amongst rhinoplasty surgeons in the world, they really are the most giving and generous in terms of sharing information and knowledge. And the world of rhinoplasty in the last 2-3 years has really, really catapulted, even during COVID. So I feel we're privileged in terms of where we are. We're privileged to be part of an international community of really amazing people, and it makes it even more special to be part of the rhinoplasty world.
That's cool. Okay, so Stu, let's get a bit more technical now. Like, I think you and I are very kind of at the same place where we exploring preservation rhinoplasty very seriously. I mean, we were both in Bergamo. Before Bergamo, I went to visit a couple of the heavyweights, and afterwards, and you've then taken it further, and you actually were at the combined meeting in Istanbul that Goxel and Barish arranged with Dean. He came over as well. So what are your thoughts now compared to perhaps a year ago in preservation rhinoplasty? Now that you've started to do a few preservation cases, I'm so interested to hear what you think about it.
So, I mean, this is really, I mean, as a society, I guess we're just scratching the surface, particularly understanding that we haven't even got the basics from a country, from South African rhinoplasty. We haven't even got the basics in terms of the fundamentals in terms of structural rhinoplasty nailed down. So I think that we have to understand that the techniques are moving at such a speed, and just as every other, I think when preservation rhinoplasty came out, it almost was presented as an alternative type of rhinoplasty. And I think through the last couple of years, one's understood that it's more tools in the toolbox. I mean, and so it's not, for me, it's not an and or. It's the necessity that one learns these techniques and applies them appropriately. So I think, from the beginning, I think you tread gently, institute these techniques when it's entirely appropriate. If you have a doubt and you feel that your old technique is going to give you a better result, then stick with that. And I think as you gain more information, more knowledge and more expertise and more comfort, then you can slowly transition to the more difficult cases. I think, I know, being at the combined meeting in Istanbul, he really gave a beautiful presentation of his first 6 cases verbatim. He spelled them out, and he said his first case was some guy who said he didn't mind if the dorsal hump wasn't completely removed, and he said, "That's the one I'm going to start on." He said, "This is the one," and so I think careful selection of your preservation cases to start off with, I think, is essential. But I don't think it's an option not to incorporate preservation. And equally, I think the techniques for closed rhinoplasty, I remember so many of the meetings we used to go to, and there was the closed group and the open group, and there were sparring matches between the two. Again, I think that's the wrong approach. I think, as a rhinoplasty surgeon, I think you've got to develop closed and open skills. You've got to understand the techniques in preservation, and you apply them, learn to apply them appropriately through experience. But you should have all of those tools in your toolbox. So I think this discussion about, do you do it open or closed, or do you do preservation? I think that's less relevant now. I think all of us are understanding that you need to know them. You need to know all these techniques.
And what's going to be really nice is this the SORSSA Surgical Summit in November that we presenting here in Port Elizabeth, of all places, where we're going to be able to have.
Well, we've been
yeah, but there's going to be cadaver dissection. We've got 6 piezo machines that we're bringing in so that people can learn from 2 of the world's most eminent rhinoplasty surgeons, Sam Most and Wolfgang Gubisch. I mean, they're going to be here with us. You can go on a safari with them, then go to the cadaver lab and then watch them operate. Each of them are going to do a primary and a revision case. So I think it's just a real opportunity for the South African and obviously any visiting surgeons to come and hang out and learn more, be a rhinoplasty geek.
I think, Cam, that's the thing is, one of the most important thing is how do you introduce all these new techniques? And I think it starts in the cadaver lab and it starts with observation. So I think opportunities like these exactly where those that have absolutely no experience, I think this is where it starts. So I think great invitation to anybody who's looking to get onto the preservation techniques. This is the kind of opportunity I think that you should really be diving into at this stage.
Okay, so Stu, tell me, whenever I go and visit some of these guys overseas, I go through a moment of just feeling so depressed, and I think to myself, I'm a kindergarten. What am I doing? Here I am. I'm dedicated to rhinoplasty. I mean, you know how much we love it. We've set our practices up for it. We eat, sleep, drink it. But you look and you think to yourself, when am I ever going to become as good as these guys? Eh? How do you handle that?
You're right. Well, you sit and you observe and you have these beautiful kind of moments of seeing people that in flow. It's a beautiful thing to watch. I was actually quite fascinated with those processes, funny enough, because I think the techniques, you and I, we've kind of studied them long enough. We know about them. But the one thing that occurred to me that was so interesting is that the techniques that are used are not different. So the guys you're watching who really are just in the zone and everything just works beautifully. Experience you can't buy. I'm afraid that's the 10,000 hours first of all. So, you got to understand that's the first thing. But the other thing I think is the process. There's a slight disjunction between knowledge, between experience, and this ability to make the absolutely perfect decisions, both in quantity and quality, to get the absolute result with very clean operating skills. And I think that's a process that that takes a very long time. I think and I think it's about the dedication. It's about looking, and this is stressed often. It's looking at your results, looking at the things that you didn't do right. You learn a lot more from the ones you didn't get quite right. And so documentation, intraoperative photographs, videos, reviewing that, seeing where you went wrong. That's absolutely critical to be able to do things differently the next time. It's beautiful to watch. It's amazing to watch. It's like a great sportsman. It really is like watching a great sportsman perform at the top of their level. And, I take absolute joy in that, I've got to say. And we can aspire to that and we can learn from it. So it's not, I don't see it as a negative, but it can be quite frustrating at some time as well. It's a funny thing, I always have this, and I have this kind of analogy about rhinoplasty. It really is a little bit like golf. The pros are out there and they're playing, and your patients, you got to kind of make the cut. The cut happens after 2 rounds of golf. But the top guys, the top golf players, they don't win every tournament, Cam, but they make the cut. They make the cut in 90-something% of cases. And so that's what we need to do. We're not going to give every patient a perfect nose, but we've got to make the cut. And so for me, it's really just about being able to achieve a certain level every time. And every now and then you're going to do something very special, and win a tournament. But most of the time, you've got to get those patients over the line.
Yeah. Okay, so Stu, I even can tell the listeners that Stuart Geldenhuys sleeps with Dean Chiromi's book next to his bed. Stuart, what do you do when you don't do rhinoplasty?
I've got a few next to my bed. Yeah.
So what do you do when you don't do rhinoplasty? What are some of your other things you get up to?
Cam, I think for me, I think it's important. I mean, like I know you subscribe to the same things. Balance in life is critical. I can quite happily say I'm a family man. I love spending time with my family. I'm passionate about traveling. I think the experience that we get from being in different environments is something that enriches me constantly. I mountain bike, I kite surf, I do yoga, I walk in the mountains. So I really enjoy kind of being out. I love socializing, spending time with mates like you when we get the opportunity. So I like a fairly diverse lifestyle in terms of many different things, but work occupies a large portion of our time. So when I'm there, then rhinoplasty is definitely where I want to be.
Work hard and play hard, eh?
Of course.
Yeah,
of course.
It's awesome, eh? And so Stu, I'm trying to think that other things listeners would really want to know more about, is what would your encouragement be to like the young plastic surgeons who still residents or registrars? It's really, really hard work, and they work so hard to get to become a resident, and then your residency is hard work. What's your kind of inspiring message towards plastic surgeons? Because bearing in mind, the world we live in is expecting instant answers, and it takes so long to become good at an operation, which is really difficult.
Yeah, absolutely. Look, I think the biggest thing is that you need to make up your mind at some point whether rhinoplasty is something that you want to be doing. I recall when I was a resident, I recall there was a very clear directive that if you were wanting to do cleft lip and palate surgery, you had to be doing at least a couple of weeks. So that when you had finished your training, if you weren't doing a couple of lips and palates, they felt you probably shouldn't be doing it because you were doing a disservice. And I might be intentionally controversial, but I think rhinoplasty really has got to that level in terms of complexity, where I think people need to understand is that they're going to be embarking on rhinoplasty. They need to dedicate themselves to doing rhinoplasty. And in the beginning, clearly their expertise won't be there. But if they've spent enough time with colleagues, if they get colleagues, their senior colleagues to come and assist them. I mean, in our theatre, we have an open door policy for residents to come in. We house two of the teaching universities. They have some of their residents join us. We are affiliated with ISAPS, and we have a fellow with us at the moment, and we have a new fellow every quarter who joins us. And part of theirs is obviously learning about different techniques. But I think the opportunities are there. If you want to be a rhinoplasty surgeon, I think you need to dedicate yourself because the complexities these days will dictate that that's necessary in order to get consistent results. I mean, I think that really is I don't think you can. I don't believe that you can be a competent rhinoplasty surgeon and do one every 2 months. I think there'll be one or two cases that might fit into that in that category. But I mean, when we started, Cam, I don't know what kind of education you had in rhinoplasty, but it was I learned a closed dehumping in fracture with a cephalic resection. That was the rhinoplasty, and I would say maybe 1 in 10 patients long term would have a stable tip and no inverted V deformity. So in other words, if the nose didn't conform to the procedure long term, it wasn't successful. And things have moved on very substantially since then, and the complexities in our understanding. So I think it really necessitates younger surgeons becoming dedicated if they want to do rhinoplasty. And I don't know what percentage of revision cases you do. I'm seeing probably more than 50% of my cases have had surgery before. So for me, that's really indicative of the population who've had surgery before.
Yeah, but Stu, I think that's what SORSSA is all about. It's about trying to increase having better patient outcomes at the end of the day. So if we can upskill each other and learn from each other and get better, then we're going to have better patients. So Stu, I've got one last question. Yeah, carry on.
Yeah. No, I was just about to say is, why does a younger surgeon have to go through the same kind of process that we went through? We can hand that information over so that they can start where we are. I mean, I wish in a way that I had somebody who could have started me off where I am now. And I'm very jealous of those like Aaron, who he had a dream start in life. He had a dream start, and there are many others of us. But to have that opportunity, really just increases your ability immensely and long term.
Yeah. So Stu, my last question, it might be kind of difficult to answer, but is there the one thing that why you do rhinoplasty? What's that? If you could put your finger on one thing, what is it?
It's not one. First of all, I love a challenge, Cam. That's the first thing. Absolutely love a challenge.
My brother from another mother.
I love the challenge, first of all. So that's exciting. I think it's the preoperative analysis, and opening a nose is a little bit like opening a packet and seeing what's inside. And then also to have the tools and the techniques that you can manipulate and change shape, for me is just spectacular, and that it necessitates an aesthetic understanding and an understanding of balance and proportion. I mean, I don't see that there's any more challenging surgery. And I love a challenge. So yeah, it's no one thing, but it is a combination. It is a combination of factors. But the challenge is a beautiful thing.
Sure. That's awesome. Yes. So Stu, I just wanted to say thanks on behalf of the listeners, guys. I hope I've just opened a little window into Stuart Geldenhuys' life. He's one of the nicest people I know on this planet. He's got such an incredible skill as a surgeon, and he's just an inspiring human being. He's got a lovely family. And Stewie, it's a privilege to be able to call you a friend and a colleague. And thank you for today. Thank you for this lovely chat we could have had. Guys, thanks so much for the people from around the world who send messages constantly about this podcast. It gets a bit tiring sometimes to wake up in the middle of the night and record, but it's worth it. It's just so nice to be able to chat to people. A shout out to Pentax Loops. Karin, thank you so much for enabling this month. And Stu, thank you from the bottom of my heart.
Cameron, and the same goes for me. The last 5 years have really been really special, and it's been great to get to know you better and to work together with you. And thanks for having me on your show.
So guys, come back next week. We're going to have some more interesting discussions. So thank you again, and have a great evening.